Have you ever looked in the mirror and noticed something new? A strange little red spot on your chest that wasn't there last month? Or perhaps you've noticed your hands seem to be bruised more easily, even when you can't remember bumping into anything. We often dismiss these little changes as just another part of getting older, just a part of the package, we tell ourselves. But what if I told you that your skin is trying to send you a crucial message? What if these seemingly random marks are actually quiet warnings from one of the most important and most silent organs in your body? The liver is a true workhorse, performing over 500 vital functions without ever making a fuss. But when it starts to struggle, it can't send you a text message or an email. Instead, it sends signals to the one place you can't miss them: your skin. Ignoring these signs is like ignoring the check engine light on your car. You might get away with it for a while, but eventually, the engine will fail. Today, we're going to become health detectives. I'm going to show you 7 specific and sometimes strange skin signs that your liver is in trouble, and more importantly, what they mean, so you can catch the problem before it becomes a crisis. Now, I know that can sound a little intimidating, but knowledge is our greatest ally. Before we dive into the first sign, if you're ready to be proactive about your health, please consider subscribing to join our supportive community. And tell me in the comments below, what's one health concern you'd like us to cover next? Your voice helps guide our conversations here. All right, let's begin with our first clue. It's one of the most classic and visually distinct signs of potential liver distress, and it has a memorable name: spider angiomas. You might hear a doctor call them spider nevi. Now, don't let the name frighten you. They aren't related to spiders at all, but they do look like tiny red ones sitting just under the surface of your skin. Picture a small, central red, like the body of a spider, with tiny, thread-like blood vessels radiating outwards, like little legs. They most often appear on the upper parts of the body: the face, the neck, the shoulders, the chest, and the arms. So why do these appear? The answer lies in one of the liver's lesser-known but critical jobs: regulating hormones, particularly estrogen. In both men and women, the liver acts like a sophisticated processing plant, breaking down hormones once they've done their job to keep everything in balance. When the liver is damaged or struggling, whether from fatty liver disease, alcohol, or other conditions, it loses its efficiency. It can't process estrogen effectively anymore. Consequently, estrogen levels in the bloodstream begin to rise. This excess estrogen has a peculiar effect on the tiny blood vessels, called arterioles, that are close to the skin's surface. It signals them to relax and widen, or dilate. This dilation is what makes them visible, creating that distinct red spider pattern. Imagine you're getting dressed one morning and you notice a new red blemish on your upper chest. You might think nothing of it, maybe an insect bite or a minor irritation. But then a week later, you see another on your shoulder. You might press on the center of one, see it turn white, and then watch as the red color rushes back into the legs as you release the pressure. This is a classic characteristic. It's this pattern, noticing one, then another, and another, that can create a quiet, nagging worry. It's not painful, it's not itchy, but it's there. It's a visible question mark on your skin. While a single, isolated spider angioma can sometimes be normal, the appearance of several, especially in that upper body distribution, is a very strong hint from your body. It's a clear signal that it's time to have a conversation with your doctor, specifically to check on your liver's health. Let's talk about those hands. The second major clue our liver can give us is a condition called palmar erythema, which is a straightforward medical term for reddened palms. Now, this isn't the temporary flush your hands get after being out in the cold or holding a hot mug of tea. This is a persistent, often symmetrical redness that settles in and doesn't leave. Specifically, It tends to affect the fleshy parts of the palm, at the base of the thumb and the little finger, while often sparing the center of the palm. In some people, it can look blotchy, and for others, it's a more uniform, deep red hue. The mechanism behind this is a direct cousin to the one that causes spider angiomas. Once again, it comes back to the liver's struggle to regulate hormones. That same buildup of estrogen that we discussed earlier causes the tiny capillaries in your hands to dilate or widen. This widening brings a rush of blood closer to the surface of the skin, creating that characteristic red appearance. Think of it like a network of tiny, tiny garden hoses in your palms. When the tap is turned up too high, the whole area looks flushed and red. And just like with spider angiomas, this sign is often painless. Your hands might feel slightly warm to the touch, but typically, the redness is the only symptom. Imagine this scenario. You're sitting at the kitchen table, perhaps shuffling a deck of cards for a game of solitaire, and you pause. You look down at your hands and notice that redness along the edges. You compare one hand to the other and see the same pattern. You might think, that's odd, and then dismiss it. Maybe you wash dishes with hot water. But the next day, while you're driving, you see it again on the steering wheel. It's this persistence, this quiet constancy, that is the real signal. It's easy to write off as poor circulation or just a quirk of your skin, but when it's coupled with other subtle changes, it becomes a much more significant piece of the puzzle. It's your body asking you to pay closer attention. We've looked at the quiet red flags, but this next sign is anything but quiet. It's an unrelenting, deeply frustrating sensation that can disrupt your sleep and your sanity. Intense, widespread itching without any visible rash. In the medical world, this is called pruritus. And I want to be very clear, this is not the familiar itch of dry winter skin or a reaction to a new laundry detergent. This is a profound, maddening itch that seems to come from deep within the body. People often describe it as being most severe on the palms of their hands and the soles of their feet, and it has a frustrating habit of getting much, much worse at night. So what on earth is happening here? This takes us to another one of the liver's essential jobs, producing and processing bile. Bile is a substance your liver makes to help digest fats, but it's also the vehicle for your body to get rid of waste products. When your liver is healthy, it keeps this system running smoothly. But when it's damaged and inflamed, the tiny tubes that transport bile out of the liver can become blocked or compressed. It's like a plumbing backup. Bile, and specifically the bile salts within it, can't escape properly. Instead, they spill back into the bloodstream. These microscopic bile salts then travel throughout your body and get deposited in the layers of your skin. These deposits are highly irritating to the tiny nerve endings in your skin, triggering a constant barrage of itch signals to your brain. Imagine trying to fall asleep, but feeling a relentless, crawling, gnawing itch across your back, your legs, your arms. You scratch and you scratch, but it provides no relief. In fact, the only thing your scratching accomplishes is making your skin raw and sore, but the underlying itch remains untouched. You turn on the light, you search your skin for bug bites, a rash, hives, anything to explain the misery, and you find absolutely nothing. It's a phantom tormentor. This experience can be incredibly isolating and exhausting. It's not just a physical symptom. It's a psychological one that can lead to sleepless nights, irritability, and a feeling of being completely at war with your own body. If you are experiencing this kind of deep, inexplicable itch, it is a powerful reason to suspect something internal is out of balance. Let's move on to our fourth clue, which is a sign of how the liver's struggles can make our bodies more fragile. Have you ever felt like you've become a human peach, bruising at the slightest touch? You might gently bump into a countertop while cooking or knock your arm against a door frame, only to discover a large, dark, alarming bruise the next day. Or maybe you've noticed that a small cut takes forever to stop bleeding, or your gums bleed more than they used to when you brush your teeth. This isn't just about having thin skin, which can happen as we age. This is a sign that your body's internal repair system might be failing, and the command center for that system is your liver. Here's why. Your liver is a protein factory. One of its most critical production lines is dedicated to creating a group of proteins known as clotting factors. Think of these factors as a team of microscopic emergency responders. When a blood vessel is damaged, even from a tiny, unnoticed bump, these clotting factors rush to the scene, working together to form a clot, a little patch that seals the leak and stops the bleeding. This is what prevents a minor incident from turning into a major bruise. However, a sick or damaged liver can't keep up with production. The factory slows down, and it doesn't manufacture enough of these essential clotting proteins. Imagine you're carrying in a bag of groceries, and it just lightly taps against your forearm. Normally, your clotting factors would seal any minor damage instantly. But with a struggling liver, the emergency response team is understaffed. That small leak continues for much longer, allowing more blood to seep out under the skin, forming that large, dark bruise that seems completely out of proportion to the event. This can feel deeply unsettling. It can make you feel fragile, almost brittle, and you might start to become overly cautious, afraid of simple movements. You start to wonder if something is seriously wrong. It's not just a cosmetic issue. It's a visible sign that your body's ability to protect and heal itself from the inside is compromised. This failure of the liver to build what we need is serious. But when the liver also fails to clean house and get rid of waste products, it can lead to one of the most dramatic and well-known signs of liver disease, a fundamental change in the color of your skin itself. And that leads us to perhaps the most widely recognized signal of liver trouble, a sign that is impossible to ignore: jaundice. This is the medical term for a distinct yellowing of the skin and, most noticeably, the whites of the eyes. While the other signs we've discussed can be subtle, jaundice is a clear, dramatic change to your very appearance, and it's a direct result of the liver's inability to perform one of its most fundamental cleanup duties. The story of jaundice begins with our red blood cells. These cells have a limited lifespan, and when they get old, the body breaks them down. A byproduct of this process is a yellow-orange pigment called bilirubin. A healthy liver is like a master filtration and processing plant. It takes this bilirubin from the blood, chemically alters it, and sends it on its way out of the body through bile, which is ultimately excreted. This is a seamless, constant process you never have to think about. But when the liver is significantly damaged or diseased, that processing plant gets overwhelmed and shuts down. It can no longer handle the bilirubin. As a result, this yellow pigment builds up in the bloodstream and begins to deposit itself in the body's tissues. Because the whites of our eyes, the sclera, have no other pigment to mask it, they are often the very first place this yellowing becomes obvious. Imagine a loved one, your spouse or your child, looking at you over breakfast and saying, with concern in their voice, "Your eyes look a little yellow. Are you feeling all right?" You might brush it off initially, but then you go to the bathroom mirror, you pull down your lower eyelid, and you see it. It's not a trick of the light. The pristine white has been replaced by a pale yellow stain. It's a moment that can be filled with a sudden, cold fear. Unlike a bruise or a small red spot, this feels profound. It feels like your illness is being broadcast for the world to see. While frightening, jaundice is an unambiguous alarm bell. There is no guesswork here. It is your body sending its most urgent and visible signal that your liver is in serious distress. This is not a wait and see symptom. It's a call your doctor today symptom. This profound change in color shows how a failing liver can alter our entire appearance. Let's zoom in on a part of our body that can be a surprisingly detailed health dashboard: our fingernails. There are two specific changes here that can act as subtle but significant clues to underlying liver problems. The first is a condition known as Terry's nails. In a healthy nail, you typically see a pink nail bed with a paler, crescent-shaped area at the base called the lunula. With Terry's nails, most of the nail appears a stark, opaque white, almost like ground glass, with only a narrow, dark pink or reddish-brown band at the very tip, where the nail separates from the skin. The second sign is called Muir's lines. These are not ridges or indentations you can feel. They are visual lines that run horizontally across the nail bed. They appear as paired white bands, parallel to the lunula at the base of the nail. What's unique about Muir's lines is that if you press down on the nail, the lines will temporarily disappear, proving they are in the nail bed underneath, not in the nail plate itself. What connects these seemingly odd nail changes to the liver? The answer is protein, or more specifically, the lack of it. The liver, as we've learned, is our body's primary protein factory. One of the most important proteins it manufactures is albumin. Albumin is crucial for maintaining pressure within our blood vessels and preventing fluid from leaking out into surrounding tissues. When the liver is severely damaged, its ability to produce albumin plummets. This condition, called hypoalbuminemia, leads to changes in the microvasculature, the tiny blood vessels, in the nail bed. With Terry's nails, the decrease in blood supply and the increase in connective tissue in the nail bed causes that opaque, white appearance. With Muir's lines, the low albumin levels are thought to create localized swelling or edema in the nail bed, which appears as those distinct white bands. Imagine you're sitting, perhaps just idly tapping your fingers on a table, and you happen to glance down. You notice your nails look different. They're not just pale, they're strikingly white, almost looking artificial. Or you see those strange white stripes that weren't there before. It's easy to dismiss this as an oddity, perhaps a vitamin deficiency. But these are very specific patterns. They're not random discolorations. They are a quiet, sophisticated signal reflecting a systemic issue with protein production, which points directly back to the health of your liver. Our final sign is one of the most serious and advanced, representing a major breakdown in the liver's function and its relationship with the body's entire circulatory system. It presents in two ways: a swollen, fluid-filled abdomen, a condition called ascites, and sometimes a network of visible, radiating veins around the belly button, known as caput medusae. Let's first talk about ascites. This isn't the normal bloating you might feel after a large meal. This is a significant, often uncomfortable, and persistent swelling of the belly. Your waistline might expand, clothes may suddenly feel tight, and your abdomen can feel firm and heavy. This happens for two main reasons, both tied to severe liver damage, often from cirrhosis. First, as we just discussed with the fingernails, a failing liver can't produce enough albumin. Without this crucial protein to keep fluid inside the blood vessels, liquid leaks out into the abdominal cavity. Second, and just as importantly, a scarred and hardened liver creates a bottleneck in the body's circulation. Blood that is supposed to flow freely through the liver from the intestines gets backed up, like a dam on a river. This condition is called portal hypertension. This high pressure forces even more fluid out of the blood vessels and into the abdomen. This fluid buildup can be very distressing. Imagine feeling constantly full, even when you haven't eaten much. You might have difficulty breathing deeply because the fluid is pushing up against your diaphragm. Bending over to tie your shoes can become a struggle. It's a physical burden that profoundly impacts your daily life and comfort. Now, in some cases of severe portal hypertension, the body tries to find a way around the blockage. It reroutes the blood flow through smaller, superficial veins. This intense pressure causes the veins around your navel to dilate and become visible, radiating outwards like the snakes on the head of the mythical Medusa, hence the name caput medusae. Seeing this pattern of engorged, snake-like veins on your abdomen is an unmistakable and advanced sign that the circulatory system is under extreme duress due to a failing liver. Both ascites and caput medusae are not early warnings. They are late-stage alarms indicating that the liver disease has become very serious and requires immediate medical intervention. Part 4. The empowering conclusion and summary. Approximate 100 to 150 words. We've journeyed through some truly serious and potentially frightening signs today, from the subtle to the profound. But my goal here is not to leave you with a sense of fear. It is to leave you with a powerful new sense of awareness. Each of these 7 clues, from a tiny red spider on your chest to the color of your palms, the itch you can't scratch, and the messages in your fingernails, is your body communicating with you. They are the visible language of a silent organ. You are now equipped to be the detective of your own health. You understand the why behind these signals. This knowledge transforms you from a worried observer into an informed advocate for your own well-being. This is about listening to the whispers before they become shouts, so you can start an important conversation with your doctor. It's about taking control, preserving your independence, and protecting the vibrant life you deserve to live. If you found this information valuable, please give this video a like. It tells YouTube that this is important content and helps it reach others who need to hear this message. And remember to subscribe so you don't miss our next conversation. Until then, stay curious, stay informed, and take wonderful care of yourself.